You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. We're back at Stellar Success Podcast. I'm your host, Dr. Tudor Francu, and I have a great guest today from Columbia, South Carolina, Dr. Shelley Janssen. How are you, Doc?
I'm good. How are you today?
I'm great.
Good.
You've been a leading leader in healthcare recently. Can you tell us a little bit about your journey? How did you start your career?
Sure.
What happened in the meantime, and where are you now?
Okay. Yeah, glad to. I started out in family medicine. I'm board certified in family medicine, and I started my first job as a physician. I worked with an OB/GYN, and I saw women and children, and he did all the OB and GYN care, although I also did low risk OB. So delivered babies, took care of babies in the newborn nursery, had hospital patients, had the private practice, and did that for 5 years, and was really, really busy. I loved it. I learned a lot. I enjoyed taking care of patients, longitudinal care, although it can be challenging. I enjoyed it, but I had a small child, and there was a lot of call and a lot of missed opportunities to spend time with him. So I left that job to go to a federally funded healthcare system that was mostly migrant care. And I learned a lot there. But because I took a salary cut when I made that move, I started moonlighting in urgent care. And I caught the urgent care bug, and it took me a couple of years before I moved over to urgent care full time. And shortly thereafter, I became medical director for the clinic I was working in. And so that was my foray into leadership as well.
When did you start working in urgent care system?
I started working in urgent care system, about 21 years ago. Yeah.
Okay. A lot has been changed in the system since then, and I'm sure you know all about it. So I want to kind of get a little glimpse in where the urgent care system is right now.
Urgent care is a tough industry. A lot of healthcare is struggling right now. Payer reimbursement is not optimal. Labor costs are going up. Supply costs are going up. So the margin on urgent care is getting more and more narrow. So you have to be pretty savvy to make it. And there's more and more competition. When I first started in urgent care, it was, it was doc in a box, and it wasn't thought highly of, and there weren't a whole lot of them. And patients were suspicious of urgent care, and other healthcare providers were suspicious of urgent care, but now it's very well accepted. I think some of that's because of the convenience and the quality and the cost savings that urgent care can provide, but also because, we have a primary care provider shortage in this country. A lot of patients don't have primary care, haven't established them, and they go to urgent care for urgent cares as well as some primary care needs too. So urgent care competition is still growing. I think that's going to taper off here eventually. We have to be really strong in urgent care because there's in certain areas, certain metropolitan areas, they're so packed, they're so dense. A lot of people just go to the one that's most convenient. So it takes a lot to stand head and shoulders above the rest so that patients will drive past one urgent care to go to your urgent care because of the quality of care they receive there.
Yeah, that's true. There is an urgent care at every corner, like the gas stations are, in some parts of the country. And it's hard to know which ones are good, which ones are not. And from my experience, I've encountered people that told me that, one of the downsides of the urgent care presently is that you go in there, you get seen by, a PA. You're lucky if you get seen by a doctor. And there's not much lab work or tests that can be done there in some of the centers. How do you see this evolution of the urgent care comparative to the emergency room care in terms of testing and the capacity of having, an X-ray, someone who can read the X-ray, someone who can make a diagnosis right away?
Mm-hmm. Well, in certain states and in South Carolina, we're currently facing this. We have a X-ray tech shortage. We're just not producing enough X-ray techs, and the ones that are being graduated from programs are being snatched up by hospitals that have to have techs. So although we have X-ray equipment in all of our urgent care centers, we don't always have tech to operate those. And the regulations in South Carolina require a tech to perform X-rays. It's not so stringent in other states. So, you have the X-ray tech shortage. X-rays are expensive. Advanced practitioners sometimes aren't very confident in reading X-rays. We don't have more advanced modalities such as MRI and CT. Some urgent cares have point-of-care ultrasound. And I think urgent cares are going to be looking more and more into that. So as far as X-ray diagnostics, it's a challenge right now, but patients expect that. When they come in with an extremity injury, they expect at least an X-ray at that site. Sometimes when we don't have one in our facility, we'll send them to a sister center, which is not ideal, but, at least, they're going to go somewhere and get an answer that day. But they do expect point-of-care service for X-rays. And they also expect point-of-care service for a lot of labs. But the CLIA wave labs are easiest for urgent care centers to do because there's less regulations around those. So a lot of them will do the point-of-care testing for flu, COVID, strep, sometimes RSV, urinalysis, urine pregnancy test, but not do anything much beyond that because of the regulatory issues with tests such as CBC and chemistries. Now that's getting better. More and more companies are developing point of care CLIA wave testing in those arenas, and those should be available very soon in the near future. We also have other companies that are providing molecular testing for common either urinary tract diseases, respiratory diseases, and providing those results within a day's time. So you swab the patient, it's picked up that day, but the next morning you have the results. So you know exactly which virus is causing their illness, whether it's RSV or rhinovirus or adenovirus, or which particular pathogen is causing their urinary tract infection and what antibiotics it's sensitive to. So we are really trying to step up and meet that need for more point of care or next day results because of patient demand and just because we're trying to help keep patients out of the emergency room unnecessarily.
Yeah, absolutely. In the same time, you need to make money.
Yes.
And this is probably one of the challenges that you deal with every day. And as a leader, what do you think there are certain skills that you need to put at work to make all this happen in your business right now?
I think you have to have an open mind and be willing to look at all the options. You also have to be a great communicator. So I have to communicate with everybody in my organization. I'm going to communicate with my director of quality and safety, my revenue cycle team, because we've got to crunch the numbers and see if we introduce a test, whether the payers are going to reimburse that. Sometimes we do a pilot because we don't know if the payer is going to reimburse it. So we do a pilot in a center or two, and then we send off the claims and we can see. You've got to communicate with the providers, the clinicians in your organization, the lab department. So it's very important to know who all stakeholders are in the organization and to be very transparent and include everybody in your communications.
Yeah, absolutely. It's a team decision.
It certainly is. Yes. You learn that pretty quickly in these roles.
Yeah. How hard it is to be a leader in healthcare right now?
I don't know is that it's that hard, as long as you have the desire to do it. And as a clinician, when I first took on this role and I stepped away from patient care, only occasionally, see patients these days. There was a lot of guilt associated with that because I was used to one-on-one with the patient, working in the trenches, getting that satisfaction, that direct satisfaction from knowing I helped somebody and took care of somebody that day. So now I have to step back, and my role is to support those who take care of patients and see my bigger role. And that took a while for me to get comfortable with that and lose that imposter syndrome and embrace the role that I have now and really get to enjoy what I do and feel good about the role I play in healthcare.
Yeah. So what do you think success is for you? How would you define success?
I think success is being respected and helping young leaders grow into their leadership roles. And that's how I would measure my success. I have several medical directors that work under me, have a lot of potential. And sometimes I'm hard on them, but, I always go and explain to them, it's because I care so much. I see your potential. I know what you can do, and I want to help you reach your goals. So that's really how I would define success, is growing other healthcare leaders.
Interesting. So what are your goals? Do you have anything lined up in the future, near future, that you want to accomplish?
Well, we've recently gone through an acquisition. This is the second week, I think, of that. And we've had a rough couple of years post-pandemic. And I'd really like to see this company turn around, become profitable, grow and open up more centers, provide more services to the residents of South Carolina, maybe even some neighboring states. I'd like for us to, if it's needed, to do more primary care. Right now, we do a little bit of primary care. I think to do it well, we'll have to have two separate tracks in our offices, one for urgent care and one for primary care. And particularly in our rural areas, there's such a need for that. I'd like to see us be able to do that. Provide more educational opportunities for the clinicians in our centers. See us embrace more technology, especially AI, and decrease their administrative burden. Our motto, our goal is to, provide exceptional, convenient, cost-effective healthcare. And I don't think we're quite there yet. I think we could do a better job of that. And I would really like to feel better about that mission before I step down from this role.
Now, kind of looking back in your career and your personal approach to this, to be a successful person, you need to have some setbacks that push you forward. Do you think there was anything in your past that you can give as an example of something that didn't necessarily work out, and you learn from it and you did better next time?
I guess it's been 8 years ago now, I stepped down from a medical director role for a healthcare system. I was feeling burned out. I felt like some of the promises that were made to me when I took on that role, and I've been in it for 8 or 9 years, hadn't been fulfilled. I felt that administration wasn't listening to me about the needs of our urgent care center. And, I just decided I would resign. I gave my notice, and I didn't have a backup plan. Because I'm fortunate to be a clinician, I can work anywhere and do anything as long as it's taking care of patients. And that was what I thought I would do. I wanted to do some locum tenens work. And while I was getting ready to do that, that takes a while. You have to get credentialed and licensed in other states. I applied for a PRN physician job with Doctors Care, where I am now. And Doctors Care, we have 52 locations across the state. We're all over the state of South Carolina. I thought, well, not just, Doctors Care is well known and it's everywhere. I'll see if they need somebody PRN while I'm working on this locum tenens gig. And so I came on board as a PRN clinician, no administrative duties, no leadership duties, and also did some locum tenens work. And traveling around, working for other healthcare systems, really realized that locum tenens wasn't for me. There were some challenges to that, and I didn't think the pay was really worth the stress of being away from home. So I came on full time with Doctor's Care as a clinician. And in about a year and a half, they asked me if I wanted to be a medical director. And I thought really hard about that, Tudor, because I'd gotten out of administration, and there were stresses with that leadership. You always are under a lot of criticism, but I really couldn't think of anybody in our organization that was better qualified than me for the job. So I took it, and I did that role for a little over a year, and the CMO role opened, and I was asked if I wanted to do that job. And it's a challenge, and I thought, why not? I love the organization. I love the people in the organization. I traveled around a lot and got to meet a lot of people. And I thought, yes, I want to do that. It's a challenge for me. So I took that on. So it was really great. At the time, I wasn't sure it was a great career move to step back and go back to just being a clinician and not continue my leadership trajectory. But in the end, it turned out to be the best thing I did.
Yeah, that's what happens, right? When one door is closing, the other one is open.
Yes, certainly. Yes. And that's the thing about, career development, growth, particularly if you want to get into leadership, is, continue to provide high quality work, very ethical work, good job performance, really become an invested employee. And those opportunities will open up for you. You just have to be ready when they do. Yeah.
Now, speaking of a leader in this domain of healthcare, do you think there is anything that someone needs to do on a daily basis to be able to do this kind of jobs? Are there any habits or routines that you employ for yourself personally to be a good leader?
So I do some leadership reading every morning. I come to the office about 7:00. Nobody else shows up before 8:30. So I get this quiet time in the morning, which I really treasure. So I'll do some reading on leadership, and I'll also see what's going on Doximity and LinkedIn to see what trends are occurring in healthcare, particularly urgent care. I'll do some communication. I like to write personal handwritten notes to people. I think it means a lot in this day and age of technology. I put that time aside each morning for my leadership development, because the rest of the day, it's busy, it's meetings, it's interruptions constantly. So that's why I like to have that set aside time to do that. And I've always been that way to an extent. Setting aside some personal time first thing in the morning is best for me to take care of any career development that I need to do.
Yeah, I think this is a very good point you made, and very important in any company. I think the way a leader knows how to develop himself or herself first will influence everything else in that company, including the other employees' success, the company's success. So I think it's very important you said that you take the time to improve your leadership skills before anything else. And I can cite something that I heard many, many times, that the employees in general leave the leader. They don't leave the company. And this is one of the things that I start to inquire in a lot of people, the way they believe they want to be a better leader for their colleagues and employees, because that's what ultimately going to make it or break it for the company. You need to keep the good people, you need to treasure the good people, you need to entertain the qualities that they have, but first of all, you need to take care of yourself first as a leader. Is there anything that you do to, kind of get out of your comfort zone in that domain, like learning the leadership? Because this is not easy to do. We're we're not born leaders. We are taught to be leaders. We learn how to be leaders. What do you think is the most important thing to learn?
I think to be very emotionally intelligent and to have a very thick skin. I recently had the opportunity to do some leadership coaching, and I worked with a leadership coach, and she did a 360 evaluation, where your superior and your peers and your direct reports all are given a survey about you, and an anonymous survey, and you learn a lot about what people think about you. Some of it was good, but some of it was very painful to go through. There were a lot of tears shed over that. And then, I did some work with my coach for 9 months. So we did a second one, and it was much improved. I still have some work to do, but you have to be able to take a look at yourself, to step outside of yourself and really evaluate, what your impression is on people, how well you're listening to people, how well you remove distractions when you're talking to someone, how you help other people, you support other people in their goals, and to always be fair and consistent in your leadership. So I think that really was one of the hardest things. I'm not as outgoing as a lot of leaders are, so it's kind of hard for me. So when I go to a meeting, urgent care meeting, urgent care association, or one of those type of meetings, it's a little bit hard for me to meet other people, to go to the vendor room and talk with the vendors about upcoming technology. But I understand how important that is for us to keep growing and moving forward. I have to talk with vendors, and I have to see what's out there and what's coming. And I have to talk to other CMOs to see if they're facing the same challenges, and maybe they've come up with solutions that I haven't thought of. So that's also a little bit out of my comfort zone.
Interesting. Now, as a physician, there's a lot of talk about creating other passive income streams where, in case you want to retire, you're burned out, you don't want to practice. How do you see this subject for yourself?
Well, I've always said, if for some reason I get burned out by administration and leadership, I can always fall back on patient care. Still love to have that connection with patients. It's grueling and challenging, but one of the most rewarding things. So I'm fortunate in that I can always fall back on that. But I'm also foraying into some medical review writing. That hopefully will develop into an income stream. And I'm not a bad public speaker, so I've thought about maybe doing some of that as well. So I think that's important, particularly as you get farther along in your career and you think, well, maybe I want to cut back. I don't want to work full time. I might want to do some consulting in different arenas and decide where and when I want to work. I think it's important to have started developing those fairly early.
Yeah. That's a great idea, to kind of use your qualities in related activities that you can do, like you said, public speaking or consulting or medical reviewing.
Yeah.
A lot of people are very afraid to do that for some reason. They don't want to get out of their comfort zone a little bit and try those things because, like you said, you don't know. You don't know how good you are until you do it.
You really don't. I got my MBA. I completed it last May. So I was in a professional MBA program with a lot of people who were early in their careers from different industries. There were only a few healthcare people in my MBA program, but younger people from different industries. And that was challenging. Because, business, is not my first choice of the careers. And it was working with a different generation and getting used to their style of communication and their work ethics. So that really stretched me and opened me up to some different possibilities for alternate career paths for myself. I learned that I am good at writing, good at reviewing through that process, that I can speak up and state my case, even though it may not be my first specialty business. I do have an opinion, and I do have some insight from the work that I've done. So that's always getting another degree is challenging, and sometimes it's expensive. But I think for people in healthcare, it's always worth it.
Yeah, absolutely. And I think these days, healthcare resumes mostly on the business side rather than the patient care side, because apparently a lot of places are basing their patient care on the business aspect. So obviously, you need to know what you're doing with money before you make a decision on a patient care. And that's the reality of our world right now. Unfortunately, it's not the other way around. Do whatever you need to do for the patient, and see, if you make any money out of it. It's tough. It's tough, and I think leadership and business skills are well appreciated in any doctor, in any healthcare provider. If you would. If you think back in your career with whatever you learn and what you know right now, how would you advise yourself back then?
I think early in my career, I would have paid more attention to insurance and payers and how the business aspect of medicine works. I was one of those that said, I don't care who their insurer is. I don't care if they're self-pay. I'm just going to take care of the patient, do whatever's best for them, and let them work it out on the end. And that's changed a lot. That was 25, 26 years ago. It's changed a lot. Patients are very dollar conscious these days, and they want to know what things are going to cost, and they want to know up front, and they want transparency in healthcare pricing. And so clinicians can't just be all altruistic and do whatever they think. They need to consult the patient and tell them, I think you should have this, this, and this. This is what it's going to cost. We could do all that, or we could do a little bit less and kind of go from there. And this is what this is going to cost you. And you help me choose, because you know what your thoughts are and you know what your budget is. But when I first started medicine, the clinician really led the care. And, whatever we recommended was generally accepted by the patient, and they just did it. But now more and more patient care is a collaboration between the clinician and the patient.
Yeah, you're right. That's true.
Mm-hmm.
What's next coming for you in your line of work? What major things you want to accomplish?
I like to see our company come through this acquisition and have a few growing pains, but be stronger than ever. Be more better off fiscally. Also embrace technology and AI, because if we don't, we're going to be left behind. I like to see us grow and provide really high quality care, be it urgent care or longitudinal care, to the residents of South Carolina. And in the meantime, I like to help grow some of my direct reports to take over my job one of these days and do a fantastic job of it. And I'm going to work on some of my other skills, my writing and consulting, and see how that goes.
Yeah, that's great. That's a great plan.
Yeah.
It's been a pleasure having you and learning what you're doing and what your vision is. How can someone get in touch with you if they want any consulting or advice in this domain?
They can email me, certainly. It is Shelley, SHELLEY .Janssen, JANSSEN @doctorscare.com.
Awesome. Thank you for having.
Thanks for having me. I enjoyed it.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.